Hello everyone. Today I will try to cover most of the newborn examination. In first video I have already explained about the newborn history taking. Newborn examination differ according to the age of the newborn. So after birth we have to examine the newborn. So at the time of birth we have to examine for airway, breathing, circulation, baby has cried, breathing has started or not. Is there any other complication at the time of birth? Then we have to calculate the Apgar score. So all these things we have to see and examine at the time of birth. Now detailed examination should be done within 24 hours of life as early as possible. So in this mainly we have to examine the baby for the vitals, for head to toe examination and to rule out the congenital malformation. Before discharge also, we have to examine the newborn. We have to examine for any physiological or pathological jaundice, or we have to guide the mother for the prevention of hypothermia and breastfeeding is established or not. We have to check and immunization everything. At follow-up also, we have to examine for the development and growth and also the neurological functions and various other aspects. So time specific examination is required in the newborn. Now at the time of birth we should examine the baby for the term, tone and cry. If having the full term, normal tone and cry immediately after birth, then normal routine newborn care will be started. If baby is preterm, poor tone, not cried immediately after birth, then we have to start the resuscitation. Level of consciousness activity should be assessed. Details I will tell you in CNS examination video of the newborn. Airway, breathing, circulation should be checked at the time of birth, and accordingly if newborn require resuscitation then it should be started. Apgar score should be calculated at 1 minute and 5 minutes. In next slide I will tell you the details. Birth weight should be measured and gestation age by the new Ballard scoring system should be calculated. Umbilical artery and veins should be checked. So if newborn is having single umbilical artery, then there are chances that newborn may be having the congenital malformation. Orifice should be count and patency should be checked. For the nose and the anus, we should check the patency by nasogastric feeding tube. So to rule out the choanal atresia and anal atresia. And other congenital malformation and midline lesions should be checked over the front and back. Neonatal reflex should be assessed. In Apgar score, A stands for appearance of the baby, means skin color of the baby, either pink or pale or having cyanosed body. P stands for pulse, heart rate, we have to calculate. G for the grimace, reflex and irritability, crying, everything we have to see. Then A for activity, muscle tone of the baby having normal, good flex posture, good muscle tone or flaccid. And R for respiration. We have to calculate the respiratory rate in full 1 minute. So this is the details of Apgar score. Heart rate, if 0, then score will be 0, less than 101 and more than 102. So for this newborn, this is 2. Then we have to mention in the result. And then we have to check the respiration. Is it no respiration? Then 0 score. Slow, irregular, gasping breathing, then 1 score. If baby is having normal breathing, normal crying, then 2 score. So for this baby, again we will give the 2 score. Then we have to check the muscle tone. Baby is having flaccid or some flexion of extremities, then 1. If flexed extremities with normal movements, then 2 score. So for this baby is having normal movements of the body and flexed extremities, then we will give the 2 score. Then see the reflex response. No response, then 0. If only grimace, then 1. If baby is crying or sneezing or coughing, then 2 score. So for this baby, again score will be in reflex 2. Then check the color of the baby, either cyanosed or pale, then 0. If periphery are cyanosed, acrocyanosis, then 1. If baby is completely pink, then 2. So for this baby, also extremities are pink with the body. So score will be 2. So total score for this baby is 10. We have to calculate at 1 minute and 5 minutes after birth, and in normal healthy baby this peripheral cyanosis, acrocyanosis present at the time of birth, which become normal after 5 minutes. So generally score at the time of birth in normal baby 9. Now the detailed newborn examination within 24 hours of life as early as possible, and this is the chronological order to examine the baby. Whenever we are presenting a newborn case, we should write down all these points in this order. So developmental assessment, then anthropometry measurement, then general physical examination, which includes general appearance of the baby, vitals, head to toe examination. Then gestation age assessment by the New Ballard scoring system, then systemic examination, which includes neonatal reflexes. Now the developmental assessment of the newborn. In this we have to assess the newborn in 4 domains: gross motor, fine motor, social, and language, vision and hearing. So in gross motor we have to assess the newborn in 4 positions. In ventral suspension we have to hold the baby in prone position with the help of our hand over the abdomen of the baby, and baby should be lifted in air, and we have to see the position of head, back and limbs. So head will be completely hangs, back is rounded, and knee and hip joint will be extended. As the baby will mature after 2 weeks of life, baby will slightly lift the head for a moment, and slight flexion of knee and hip joint also occur. Now keep the baby in prone position. So here in this image you can see between 0 to 2 weeks of life, head is kept on one side, pelvis is high and knee under the abdomen. Between 2 to 4 weeks of life, baby will slightly lift the head and pelvis is flat and knee joint is slightly flexed and hip is extended. Now in the pull from supine position, here in this image you can see head is laid completely between 0 to 2 weeks. After 2 weeks, baby will slightly lift the head for a moment. And this is vertical suspension. We have to hold the baby vertically under the arms, and baby will uh, show the walking reflex also when feet will touch the couch. So this is gross motor. In fine motor milestone, baby will have the palmar grasp reflex. So hands predominantly closed. Here you can see in this image, this is grasp reflex. In language, cooing sound baby produce. In vision, baby follow the object less than 90 degree. We have to keep the preferably red color object 1 feet far from the eyes, and we have to move it, and baby will follow less than 90 degree. And for the sound hearing assessment, we have to ring the bell and baby will become quiet or startle response will be there. In social milestone, um, baby will have the face regard after 3 weeks of age. So between 3 to 4 weeks of age, face regard occur. Then anthropometry assessment in newborn. First we have to measure the weight, then length, then head circumference, chest circumference, then US-LS ratio, then ponderal index. So in the weight measurement, weight should be measured by the electronic weighing machine. Here in this image you can see this is electronic weighing machine. Normal birth weight between 2.5 to 4 kilogram, and baby loses the less than 10% of birth weight in first week of life. Then again regain the birth weight by 10th day of life. Then continuously baby will gain the weight 10 gram per kilogram per day. Minimum weight gain should be 10 gram or range between 10 to 20 gram per kilogram per day. So full term 3 kg weight birth weight baby will gain the 30 gram weight daily, or in weeks 200 gram per week weight gain will be there. So here in this video you can see first set at 0 electronic weighing machine, then the keep the baby. Ideally baby should be necked, and then see the weight over here. It is 1.620, 1620 grams or 1.620 kilogram weight of the baby. Then length measurement should be done by the infantometer. Here in this image you can see this is infantometer. Crown heel length. Normal length of full term baby is 50 centimeter. Now keep the baby on the infantometer, and fixed part of the infantometer should touch the head and the mobile part should touch the sole, and we have to flatten the legs by keeping the hand over the knee joint, so hip and knee joint should be extended, and see the length of the baby over here. For head circumference, we should use a flexible non-stretchable measuring tape. Head circumference also known as occipitofrontal circumference, and here in this image you can see in front we have to keep the measuring tape over the supraorbital ridge just above the eyebrows and over the back at the level of occipital protuberance. It is the most prominent part of occipital bone, and tape should be above the ear, and use the cross method to measure the head circumference. And ideally head circumference should be taken after 24 hours of birth because of the molding and because of caput succedaneum. Sometime within 24 hours head circumference will not be accurate, so ideally should be measured after 24 hours when molding already resolved and caput is also slightly subsided. Normal head circumference at birth is 33 to 37 centimeter. Then it grows 0.5 centimeter every week, or we can say 2 centimeter per month. So in first 1 month of life, 2 centimeter head circumference growth occur. Here in this video you can see how to measure the head circumference. Keep over the supraorbital ridge, occipital protuberance just above the ear. Here in this image also you can see here over the occipital protuberance, supraorbital ridge over the infront and just above the ear, and use the cross method. So here 35 minus 4, 31 centimeter head circumference of this baby. Now the chest circumference should be measured at the level of nipple by the measuring tape. Normally at birth it is 32 centimeter. It is 3 centimeter less than head circumference at the time of birth in full term baby. Now in this video you can see how to measure the chest circumference at the level of nipple. By cross method we have to take the chest circumference. So this baby is preterm and also IUGR. So having by cross method 28 minus 3, 25 centimeter chest circumference. Now upper segment lower segment ratios should be measured. So upper segment between vertex to pubic symphysis, and lower segment between pubic symphysis to foot. Normal at birth 1.7:1 is the US-LS ratio. Then we have to calculate the ponderal index by the formula weight in gram divided by cube of length in centimeter multiply with 100. Normally in term baby with the appropriate gestation age more than 2.5. For a small 4 gestation age baby we have to differentiate is it symmetrical or asymmetrical SGA. So for this PI less than 2 in asymmetrical SGA baby and more than 2 in symmetrical SGA baby. Then we have to plot the weight, head circumference and length over the growth charts. So for the newborns baby, International Intergrowth 21st Postnatal Growth Standards are available by the Oxford University. So this is the image of this growth chart. After development and anthropometry, general physical examination should be performed. In this, first we have to see the general appearance of the baby, then vital parameter, then head to toe examination. In general appearance, we have to check the level of consciousness, alertness, then respiratory status, having the normal respiration or any sign of respiratory distress, then color, activity and tone, then movements, then reflex and cry. So in general appearance, we have to mention all these points by rapid visual assessment to see the general well-being, and we have to identify any red flag sign is present in the baby. After general appearance, in general physical examination, vital parameters. So heart rate, normal heart rate in newborn between 120 to 160 beats per minute. Normal respiratory rate between 40 to 60 beats per minute. And blood pressure 60 by 40 mmHg. In exam, you are not supposed to measure the blood pressure in newborn because it requires the monitor, so which is not available in exam. So instead of BP you have to mention the capillary refill time. I will tell you the details of CRT next slide. And temperature 36.5 to 37.5 degree centigrade. In heart rate we have to count the heart rate by auscultation for full 1 minute except during the resuscitation when we calculate for 6 seconds and multiply by 10. An assessment of pulse can be done at umbilical, femoral or brachial artery, but auscultation for the heart rate is more accurate than palpating the artery for the pulse rate. Heart rate can also be determined by the pulse oximetry or by ECG when newborn is admitted or we are doing the resuscitation. Respiratory rate normal range 40 to 60 breaths per minute. We should count the respiration for full 1 minute by watching the rise and fall of chest. And when the baby is quiet and comfortable, we should calculate the respiratory rate. We should also check the rhythm, character, depth and signs of respiratory distress. I will tell you the details during the respiratory system examination. Now the capillary refill time. Here in this video you can see we have to apply the moderate pressure for 5 seconds over the chest to blanch the skin, and then we have to release the pressure and we have to observe the time which is elapsed before skin regain the normal color. Normal CRT is less than 2 seconds. Between 2 to 3 borderline abnormal and more than 3 considered as abnormal, seen example in shock or hypothermia. Then temperature. Temperature can be taken by the electronic or digital thermometer. Here we are using the digital thermometer. We can take the axillary or rectal or by palpation also. So we have to keep the thermometer for 3 minutes, and for the axillary temperature, tip of the thermometer bulb should be in the armpit and arm should be snug with the chest, and we have to keep it for 3 minutes and then we have to read the readings. Rectal temperature can be taken when the newborn is in NICU and when admitted, especially for the severe hypothermia or if we are giving the therapeutic hypothermia for the severe birth asphyxia in which rectal temperature monitoring is required. Otherwise, rectal temperature we are not doing routinely, and we can also take the temperature by the human touch method. In next slide I will tell you. Preferably low reading thermometer as low as 30 degrees centigrade should be used. So here in this image you can see I am taking the temperature by human touch method. So with the dorsum of hand we have to touch the periphery, sole and palm and central body part, abdomen and chest. If you find the extremities and trunk both warm, that means normal temperature. If extremities cold and trunk warm, that means newborn is having cold stress or mild hypothermia. Temperature between 36 to 36.5. If extremities, trunk both are cold, that means newborn is having hypothermia either moderate or severe. Thank you so much, and in next part I will tell you about the newborn head to toe examination.